I am the Vice President of Patient Technology, Innovation, and Efficiency. Sharp Healthcare is a 6-hospital system in San Diego, California. We are all services. We have about 18,000 employees and about 2,600 physicians. Several large awards, Magnet Baldrige Award winner and Nursing Excellence Award winners. So quite cover the entire San Diego area. Sharp Healthcare sits in kind of the middle of other health systems. So we have about 5 other health systems. We are insurance based, and we have the biggest market share right now for patients. So TeleTracking was introduced to us many years ago as part of our bed tracking housekeeping system. It was a system we really didn't keep up with upgrades and things like that. In 2012, Sharp Healthcare went after a system that would help us with our bed flow processes and also would help us with our asset management processes. So in 2013, we implemented TeleTracking Capacity Management Suite, which is bed tracking, transporter tracking, patient tracking, bed flow, remote temperature monitoring, and asset management across the 6 hospitals and some of the outpatient areas. The goals we wanted to achieve were really around patient flow. What could we do to help our patients move through our systems faster? We had, some patient complaints related to waiting for beds for very long times, and that wasn't acceptable to us. So we wanted to make sure that we could use technology to help us flow our patients and give us that real-time data so that we knew what we were doing with our patients and we weren't playing the guessing game. At the same time, we wanted to track our assets because we had issues with either purchasing too much equipment or not purchasing enough, or not being able to find things when we needed them. So that's why we purchased the asset side of the system as well. And both those systems are married together. So the nurses use the same system for patient flow as they use for asset management. One of the key challenges we had is the not definitely knowing what was going on in each of our hospitals as far as bed flow, who was going home, who was staying, where we had orders for discharges, what patients needed to move to different levels of care. We were really struggling with the I don't know, so I'm going to say no. So we weren't taking our outside patients from doctors' offices. We weren't taking patients that were Sharp Healthcare patients that were located in other facilities. That really was one of our biggest challenges to overcome. And we wanted to use TeleTracking to help us do that. So we needed to design one process so any physician, any caregiver could bring a patient to us using one phone number, one center, and we've been highly successful with getting our patients in now. We still have some challenges when we get the winter time. It's super busy. Everybody's busy. But for the most part, we've been able to show some real decreases in wait times, in bypass hours, in the time it takes from a patient getting a discharge order for them to go home. We've made some real improvements in the decrease of that. At the same time, our patients are showing us that they're happier. So that's really all been the success around the command center. It's one group of people that have all the information, and anybody can get into the system and see the same information they're seeing. So it's that visibility, it's the accountability, we're all after the same thing, and it's about the patient. Some of the ahas we had with implementing. So we purchased the system in 2012, and in 2013 we started the design in April 2013. And we had to start from scratch. We had to build a department. We had to build a command center. We had to put processes in place at the site that were the same from hospital 1 to hospital 6. No matter where you were, it was one process to get a patient into Sharp Healthcare. That all took a little bit of time, policies and procedures, but also engaging the people that were going to use the system out at the sites as well was really important, that the doctors understood what we were doing, that the staff bought off on the new process. There was a lot of pushback. We had to do a lot of education and re-education, but it was really important to take the time to do that. But we still had an aggressive timeline that we met. So in 7 months, we had everybody up and running on one system. I think some of the ahas with this system has been that we've been able to use it not just for patient flow. We've been able to bring in other process improvements around, insurance denials or authorizations. So it's not just a patient flow system. It's a whole care of the patient kind of system where we've been able to make projects show improvement that we didn't even think about in the beginning. So as you go forward, for example, we had no idea that we really wanted to centralize our transporters. We thought that we could still keep them in their own departments and just use the system. Well, we failed miserably when we did that. We relaunched the transporter system and we centralized them all into one area. And we've had amazing results. We're down to 8-minute turnaround times. We were at 37-minute turnaround times. So we never thought that in the beginning it would give us these kinds of improvements. But over and over, I now have finance people coming to me and saying, hey, how can I use the system to give me this data? And I have, the clinical and the non-clinical looking at the system to say, how can we use the system to improve our patient care? I think one of the most important things we did was we brought the system to the site and we did a lot of education with the nurses in particular because they were the biggest users. And we proved to them that they still had the ability to run their units. They were so afraid that their power, their control was being taken away. And we showed them the different activities that you do in teletracking that still gives them the ability to guide patient flow on their floors. So they weren't losing the in their mind power to place patients. They could go into teletracking and they could tell us exactly what beds to use. As long as they followed the standardized process, they still had the ability to feel like this was their unit, their patients. We didn't want to take that away from them, but we also needed them to use the process. So we did a lot of education and we did a lot of re-education after we went live. And we still, 3.5 years later, still do a lot of education. We've created modules for them to do, as reminders. This is why we do the beta head functionality, the attribute, and this is why it needs to be correct. But it was important to get their sense of what was important to them, not what we thought was important. Our TLS has brought us, again, visibility. So we had examples where we purchased equipment that we already had enough of, but we didn't know it because we didn't know where all the equipment was at any given time. So when we purchased our TLS and we tagged, we had a system committee that decided what piece of equipment do we tag, what don't we tag, what's not worth tagging. So we have a standardized list of what gets tagged and what doesn't. And we found the IV pumps is a perfect example. We were getting ready to spend millions of dollars on new pumps. And when we did the tagging process, we figured out we were over pump. We had too many pumps. So we never purchased. We saved millions of dollars just in that one exercise. We're saving millions of dollars in rental equipment because we'll rent a piece of equipment like a specialty bed and it may or may not get returned back to the company when we're done with it. But if it's tagged, we know exactly where that bed is and we return it the day the patient stops using it. That saves us a ton of money because we spend a lot of money renting things that we don't necessarily want to purchase. So it's been very helpful. And the staff has, for lack of a better way of saying it, stopped hoarding equipment and hiding. because they can look in the system and they can see exactly where that bladder scanner is or exactly where that piece of one-of-a-kind equipment is because it's tagged. So we are using, we have some staff that has tracking badges in conjunction with our call system. So TeleTracking and Hillrom and the staff tracking, they're all working together so that we don't have two separate systems. But we do track staff, and we've not had any issues with the staff complaining because we don't track them in their break rooms, we don't track them in the bathrooms. But they like being able to find their coworkers when they need to without walking up and down the hall yelling a name. So it's been very successful as well. And as we do remodels of different areas, we're putting in staff tracking.